Hello, I am Dr. Abraham. Today I'll be discussing about the role of finasteride in hair loss and in hair transplant. Finasteride is a 5-alpha reductase inhibitor. So finasteride prevents the conversion of testosterone into dihydrotestosterone, DHT. As you know, DHT is the active compound which causes miniaturization and thinning of hair in male pattern alopecia. Finasteride was one of the drugs which was approved by the US FDA in 1998 for the treatment of male pattern alopecia. Finasteride is not a cure for male pattern alopecia. However, it does reduce the miniaturization and thinning of hair in patients who do take it for a minimum amount of time. As I mentioned before, finasteride along with Minoxidil are the approved drugs by the US FDA for treatment of male pattern alopecia. Patients who have been diagnosed with male pattern alopecia and are experiencing thinning of hair and progressive hair loss are recommended to start treatment with finasteride. In the post-hair transplant scenario, finasteride is recommended to prevent shock loss. Yes, finasteride can be taken by women who are suffering from female pattern alopecia. We recommended lower doses like half milligram in premenopausal women and much higher doses for women in the postmenopausal status. Different doctors and clinics prescribe varying doses of finasteride. However, studies have shown that the beneficial sweet spot dosage is between 0.8 milligram to 1 milligram per day. One should take finasteride as long as one is experiencing miniaturization and hair fall. The effect of DHT in men is quite strong until the age of 50-55. I recommend patients taking finasteride in cyclical doses every year. To see the beneficial effects of finasteride, one should take it for a minimum of 3 months, and the maximum benefit of finasteride is seen after one has taken it for at least 6 months to 12 months. Finasteride is contraindicated in patients who have a history of prostate cancer, breast cancer, those who have a hypersensitivity to finasteride, people with depression and suicidal thoughts, liver dysfunction, and those who are planning to get pregnant, and in breastfeeding women. Saw Palmetto is a very weak DHT inhibitor. Hence, it is not an alternative to finasteride. Saw Palmetto can be used in patients where the use of finasteride is contraindicated. Finasteride is a very safe and proven drug. Studies have shown that only 0.5 to 1% of patients experience some form of side effects. The side effects can be pain in the breast, pain in the testicles. Some patients complain of decreased libido, erectile dysfunction, decrease in the ejaculate volume. It can also cause some form of depression and anxiety. Most of these sexual dysfunctions and side effects are reversible, and once the patient stops finasteride for 30 to 60 days, the side effects are reversible.